Apart from these pathological conditions, we have some congenital conditions and acquired conditions in the brain. So we call them as AVM or the arterio-venous malformation. So what do you mean by an AVM? AVMs are an anomaly because what happens is an AVM is being formed of by an arterial supply and a venous supply. The capillary loops get connected. So normally what happens, an artery gets connected with the vein via the capillaries. But what happens when the artery is connected to the vein directly? So we all know the artery has three structures: tunica adventitia, tunica intima and tunica media. But what happens in the vein is like the inner structure, the tunica media, is not well defined. So arteries are more thicker and stronger than the veins, and the hydrostatic pressure within the artery is much more high than that of the veins. So what happens is, during a normal circulation, the pressure that is flowing from an artery is more than that of the veins. So what happens if there is a direct communication or contact between the arteries and the veins? The pressure in the artery would cause a collapse or the rupture of the venous capillaries. So this would result in hemorrhage. So AVMs, the most important complication is hemorrhage. As a result of hemorrhage, the tissue, it can also become a hematoma, or the blood clot might form a hematoma, and this might give rise to elevated intracranial hypertension with constitutional or neurological signs and symptoms. AVMs can be classified as simple and complex. So what do you mean by simple is that when there is only one segmental artery that is feeding the loop of arteries and veins, it is a simple AVM. Well, when there are multiple such segmental arteries feeding the loop of AVMs, it becomes a complex AVM.